What's up, guys? Meet Donald Tan. He's a 20-year-old university student who was diagnosed with depression at the age of 18. One day, he woke up and didn't feel quite like himself, so he decided to go to the hospital to get himself checked out. Here's what happened at the hospital. Hey Donald, what brought you here today?
I feel like trash and I want to go home.
Okay. Are there any reasons why you want to go home now that you're already here?
I don't know.
You seem frustrated. Can you tell me what you did before coming in today?
I was partying
Okay. May I ask, when did the party end?
yesterday around 5.
I see. Do you have too much to drink?
No! Don't you dare say I'm drunk. I'm not.
Sorry, but I have to ask, are you feeling dizzy?
A little. Why?
Okay. Well, how much do you drink last night?
Like 20-ish glasses of soju? I don't know.
I see. Do you usually drink this much daily?
Yeah, it's nothing much. I'm used to it.
What do you like to drink?
Soju is good. I like beer too.
Ah, I see. Have you ever tried cutting down?
Yes, sometimes I feel that it is bad for me.
Okay. Have you ever felt annoyed when people ask you to cut down on drinking alcohol?
No, I don't think so.
Okay. Have you ever felt guilty about your drinking?
Yes, sometimes.
Okay. Do you feel the need to drink once you wake up?
Yeah, maybe once in a while.
Alright. Thank you for your honesty. Can we run some tests to perhaps get a better idea of what's making you feel so down lately?
Okay, go ahead.
Upon physical examination, Donald had a heart rate of 150 beats per minute, which meant that he had tachycardia. His blood pressure was 140/95, which meant that he was hypertensive. His blood glucose was 3.5 millimoles per liter, which meant that he was hypoglycemic. And his urine and blood tests tested positive for a specific compound. With all these hints in mind, what's your diagnosis? If you said alcoholism, you're right. Donald is suffering from alcoholism. Alcoholism is the continued excessive consumption of alcoholic drinks. The differentials for alcoholism are anxiety disorder, panic disorder, and bipolar disorder. To clinically diagnose alcoholism, a CAGE questionnaire is usually used and integrated into the history taking. In fact, once the patient mentions that they take more than 10 standard drinks a week or 4 standard drinks a day, this is when the CAGE questionnaire is needed. CAGE stands for C. Cutting down, A. Annoyed when asked to cut down, G. Guilty about drinking habits, and E. An eye-opener, meaning that the patient needs a drink in the morning. 1 yes to either one of these questions equals to 1 mark. If the patient gets 2 or more marks, it means that their case is clinically significant. In Donald's case, he answered yes to 3 of the 4 questions asked by the doctor. This means that Donald's current condition can be considered to be clinically significant for alcoholism. So we mentioned that if a patient consumes more than 10 standard drinks a week or 4 standard drinks in a day, we ask the CAGE questionnaire. But what exactly is a standard drink? 1 standard drink equals 10 grams of alcohol. So here's the fun part. If we take a look at the different types of alcohol, we can see that 1 bottle of soju is equivalent to 4 standard drinks, which is 40 grams of alcohol. A glass of wine is 1.6 standard drinks, while a glass of beer is equivalent to 1.6 standard drinks as well. So let's do some quick maths. Donald said that he drank 20 bottles of soju. So 20 bottles of soju multiplied by 4 standard drinks per bottle is equivalent to 80 standard drinks that night. This is incredibly high and should be taken seriously. There are several factors that put you at risk for alcoholism. Being of younger ages, being a male, and having underlying behavioral issues like anxiety or depression can increase the risk of developing alcoholism. There are several clinical features that patients with alcoholism display, and these can include red eyes, loud slurred speech, delayed reaction, loss of coordination, delirium tremens, and vomiting. Let's take a quick look at how drinking alcohol can change the biochemistry in our body. When alcohol, chemically known as ethanol, is consumed, our liver breaks it down into acetaldehyde. Acetaldehyde is a toxic compound and has to quickly be converted into acetate. This acetate can then be used to create acetyl-CoA, which can be implemented into the Krebs cycle or can be used to create cholesterol and lipids. So there are 3 locations where the alcohol is converted into acetaldehyde. The first one is the cytosol. 85% of alcohol metabolism occurs here. The second one is the smooth ER, where 10% of the alcohol is broken down here. The third one is the peroxisomes, where 5% of the alcohols are broken down here. Once converted into acetaldehyde, the acetaldehyde has to quickly be converted into acetate, and this process happens in the mitochondria. Let's zoom in into the cytosol and take a look at how ethanol is converted into acetate. First, the ethanol is converted into acetaldehyde by an enzyme known as ethanol dehydrogenase, which at the same time converts NAD+ into NADH. Take note, this NADH will come into importance later on. Then, the acetaldehyde, which is really toxic, has to be converted into acetate quickly by an enzyme known as acetaldehyde dehydrogenase, which is found in the mitochondria. Again, NAD+ is converted into NADH. The second site for alcohol metabolism is the smooth ER of the liver. This uses something known as the microsomal ethanol oxidizing system, MEOS, whereby the ethanol is converted into acetaldehyde using a CYP2E1 enzyme found in the liver. Take note that this process usually happens when there is a high alcohol consumption. The third site of alcohol metabolism is the peroxisomes, which involves the reactive oxygen species, ROS. So over here, ethanol is converted into acetaldehyde by converting the ROS into water and oxygen. So what are the important biochemical effects of chronic alcohol consumption? Well, remember the high NADH, NAD+ ratio due to high alcohol metabolism can lead to three main things: hyperlipidemia, hypoglycemia, and lactic acidosis. Here's how a high NADH, NAD+ ratio can cause hyperlipidemia. As you already know, a Krebs cycle's main goal is to create NADH. If there's already high NADH because of ethanol metabolism, what happens is the isocitrate no longer goes to alpha-ketoglutarate. Instead, alpha-ketoglutarate is converted back into isocitrate, and this isocitrate is converted into citrate. So what happens is there will be a lot of citrate, and this citrate can be converted back into acetyl-CoA. Right now, we have a lot of acetyl-CoA. But this acetyl-CoA cannot enter the Krebs cycle. This accumulation of acetyl-CoA will ultimately find itself being converted into fats and cholesterol, leading to hyperlipidemia. Secondly, a high NADH, NAD+ ratio can lead to hypoglycemia. So let's take a look at what happens. Ethanol is broken down into acetaldehyde, which is broken down to acetate, then acetyl-CoA, enters the Krebs cycle, and it can be converted back into glucose via a process called gluconeogenesis. Unfortunately, all good things come to an end, especially when you're drinking too much alcohol. It leads to a high NADH, which can put a stop to the Krebs cycle and putting a stop to gluconeogenesis, reducing the blood glucose concentration. Lastly, a high NADH NAD+ ratio can cause pyruvate to be converted into lactate instead of being converted into acetyl-CoA, leading to lactic acidosis and lowering the blood pH. Take a look at this cute, healthy liver. One day, his owner decides to consume alcohol. This ethanol is converted into acetaldehyde, which is toxic for the liver. Chronic alcohol consumption leads to a buildup of acetaldehyde. And what happens? The healthy liver becomes a fatty liver. But the owner doesn't stop. He doesn't know. So he continues drinking more and more and more alcohol, causing liver sclerosis, also known as scarring of the liver. At this point in time, the liver is already damaged, and it can cause many metabolic complications in the long term. Also remember that ethanol breaking down into acetaldehyde requires ROS, reactive oxygen species. This reactive oxygen species can attack vulnerable hepatocytes, which leads to liver sclerosis. Also, alcohol metabolism can lead to thiamine deficiency, which causes something called beriberi. And no, it's not the blueberries that you're thinking about, it's beriberi, a condition that can cause neurological symptoms such as Wernicke-Korsakoff disease. Oh, it seems that the doctor has the results for Donald. Let's take a look at what happens at the hospital now. Your results are back. Donald, we came to a conclusion that you may have a problem with alcoholism.
What do you mean alcoholism?
Well, it can happen as you're currently consuming too much alcohol. And many bad things can happen later on if your drinking habits remain the same. Common complications of chronic alcoholism is osteoporosis, which means that your bones become weaker. Atherosclerosis, which means that fats start building up in your blood vessels. Because of this, you're at a high risk of coronary heart disease and arrhythmias. Also, your liver might undergo cirrhosis, which means that it's getting scarred. Also, you might experience mucosal inflammation whereby your stomach wouldn't feel too good. Drinking too much alcohol, especially during pregnancy, can also lead to something known as fetal alcohol syndrome. Children born with fetal alcohol syndrome usually show signs of microcephaly, which means that your skull becomes smaller, as well as a smooth philtrum, which means that the bridge on top of your lips is smooth.
But I don't think I can get pregnant though.
Oh yeah, you're right. Maybe you can still tell your girlfriend or wife about this.
Well, I'm single, so it's useless, I guess.
But it sounds scary. So how do I start controlling how much I drink? I'm glad to hear that you want to change, and we can definitely come up with a management plan for you. Firstly, we can put you on IV fluids if you're feeling very dehydrated. Metadoxin is a pharmacological agent which can help clear alcohol from your blood. Also, if you feel like vomiting, we can give you antiemetics. If you're suffering from chronic alcoholism where you're experiencing delirium tremens, you might need benzodiazepines that we can prescribe. Ultimately, it's all about the long term. In order to help treat alcoholism, patients are advised to undergo rehab and counseling, as well as motivational interviewing on a regular basis. So let's start helping you right now, alright?
Yes, please. But first...
Huh?
Let me get super duper wasted for the last time with my boys.
Bruh.
Please, I swear it's gonna be the last time, doctor. Please trust me. Who cares about what you think?
Hey yo, what the
Soju, here I come.